Well, hello everyone. Well, good evening. Thank you so much for coming to our third meeting of fourth meeting of the administration. I'm so happy that you all were able to join us tonight to really discuss some of the opportunities that are going to be presented tonight. Today we're joined by representatives from the National Health Service Corps to discuss some opportunities for a very costly journey that we have ahead of us. But without further ado, I would like to welcome you all welcome and introduce you to Chris.
Thank you so much, and hello everyone, and thank you for joining us today. My name is Chris Gallipo, and I am the Chief of the National Health Service Corps Scholarship Branch. It is a great pleasure to join the Student National Medical Association's Minority Association of Pre-Medical Students to discuss funding opportunities through the National Health Service Corps. Our discussion this evening will focus on creating awareness of scholarship and loan repayment opportunities through the National Health Service Corps, while detailing eligibility criteria, benefits, and the service commitment associated with each opportunity. As mentioned, the journey through medical school can be quite costly. And we really find that our situations for our programs for the right individuals can really be a winning situation, both for our participants in the program and our great underserved communities throughout our nation. We'll move to the next slide, please. Thank you. So before we begin, we'd like to take just a quick poll to get a sense of what track our audience members are on this evening. We'll go ahead and get the poll up and share the results in just a moment. I should be seeing the poll question there. If you could just note which track you're on, that would be super helpful. And I see results are coming in. We'll give it just a minute for folks to finish up here. Very good. Well, it looks like numbers are slowing down. So it looks like the bulk of the individuals with us this evening are post-grad and pre-med students. We do have one current MD student with us as well. So thank you so much for taking that poll. We'll go ahead and bring the poll back down and move on to the next slide. Thank you. Okay. So before we go into details about the National Health Service Corps scholarship and loan repayment programs, we wanted to provide a brief overview about the National Health Service Corps, known to many as NHSC. We always use acronyms here, so we'll certainly try to spell them all out for you as we go through our material tonight. The NHSC is part of the U.S. Department of Health and Human Services and is administered by the Bureau of Health Workforce, or BHW for short. This bureau is within the Health Resources and Services Administration, also known as HRSA. Funding from the Bureau supports the National Health Service Corps and other programs that are designed to improve the distribution of health professionals to underserved areas throughout our great nation. Our purpose is really to build healthy communities by providing financial awards to primary care medical, dental, and behavioral health care providers who are committed to serving in the nation's underserved communities. Every year, HRSA programs serve tens of millions of people, including people living with HIV/AIDS, pregnant women, mothers and their families, and those that are otherwise unable to access quality health care. We are super excited to be celebrating our 50th anniversary this year. Over the past 50 years, we've provided clinicians with scholarship and loan repayment awards and are proud to support communities who recruit and retain quality primary care clinicians committed to providing care where the need is great. The 50th anniversary also provides National Health Service Corps alumni, members, and stakeholders an opportunity to reflect on the impact that the more than 66,000 NHSC clinicians have had on the lives of millions of people as it relates to health equity and the care of our nation. Next slide, please. So most recently, the program's field strength has increased to a historic number of nearly 20,000 clinicians, providing care to almost 21 million people in the United States. This large increase in field strength was made possible with the addition of $800 million in funding through the American Rescue Plan Act to help support our nation's COVID response. In 2021, we awarded every eligible applicant, making this our largest class of clinicians ever. Many NHSC members continue to serve in areas of greatest need beyond their service obligation. Next slide, please. So now that we've provided a brief overview of the National Health Service Corps, we'll move into a more detailed discussion of our programs. We will begin by touching on the eligibility and requirements and benefits of our student-based programs, which is our flagship scholarship program and our Students to Service Loan Repayment program. Then we will move into our clinician-based programs, which are available for fully licensed clinicians. And then finally, we'll highlight some of the support and resources we have available, and then finally open the floor for questions that you may have. Next slide, please. So this brings us to our next poll. We've kind of touched on the fact that, we had a lot of funding through the American Rescue Plan Act. This poll will ask in FY21, how many applications do you think the NHSC received across all of our programs? Very good, we've got results coming in. Okay, looks like the bulk of the audience is going with the over 12,000 number. We've got 69% selecting over 12,000. The next largest number looks like less than 75. 19% of our audience has selected less than 75. And then finally, 13% of the audience has, numbers are changing a little bit, up to 18. Somebody changed their answer. Over 2,000, about 18% of the audience. We'll go ahead and end the poll and close that up, and we move to the next slide and kind of reveal the answer behind the question there. Okay. So as you can see, let me close my, I don't know if we shared the results of the poll. Let me close my poll real quick. As you can see from the next slide here, over 12,000 applications was the correct answer. In fact, really, when you look at the new awards we made, that number was over 12,000 as well. Just reviewing the slide here, our loan repayment programs, which we'll focus on 3 of those tonight. We had received almost 10,000 applications for that program. Our Students to Service Loan Repayment program, which is available to individuals in their final year of their academic education, 380 applications. We have a state loan repayment program, which made awards to 41 different states. And then finally, our scholarship program received 1,982 applications. On the award side, you can see the award numbers were robust. I'd like to highlight our scholarship program on this particular slide, where we made 1,192 awards, which is really a historic number for us. Over the years, in recent memory, over the last 10 years, we really make an average of about 200 awards each year. And we've only been able to really award about 10% of our application pool, right? We generally get about 2,000 applications and make about 200 awards. Again, with that infusion of American Rescue Plan Act funding, we were really able to bolster those numbers significantly. And we are really expecting to do the same thing here in FY22. We'll move to the next slide, please. Thank you. So next we'll dive into our student-based programs, which are likely the most relevant for our audience today. We've referred to our scholarship and Students to Service Loan Repayment programs as student-based programs, as you will apply to them while you're still in school, while performing the service commitment once you're fully licensed and ready to begin your career. We will also include some information on our clinician-based programs, Again, those programs are more for individuals who are fully licensed at this point. And it may be, that you might not want to commit to a service commitment just yet. And if you're kind of on the fence about primary care, certainly the loan repayment option is another direction that you can go in. That way, perhaps you're more certain about primary care. We'll move to the next slide, please. So beginning with our scholarship program, this is really our flagship program that dates all the way back to 1972. This program has robust benefits in terms of financial benefits. I often refer to it as the Cadillac of scholarship programs. We pay full tuition and fees. The scholarship includes a monthly stipend. And then finally, an other reasonable cost payment as well for items like books, equipment, and health insurance. I really have a personal connection to this particular program as I have been working in one role or another with the scholarship program dating all the way back to 2001. The mission of this program is to provide financial support to health professional students who are committed to practicing primary care in communities with limited or no access to health care. And again, I can't emphasize enough, we do have a primary care focus. All of our programs are really a winning situation for everybody involved, provided primary care is that focus as you progress through your healthcare education. We'll go ahead and move to the next slide, please. Thank you. Okay, so this brings us to our next poll. Through the National Health Service Corps Scholarship Program, students pursuing a career in primary care can receive a scholarship now and commit to a 2 to 4 year service commitment later. This will be a simple true or false notification, and really it'll just give us a sense of how aware are you of the program already. Very good. I see our responses are coming in. I'll give it just another minute for the numbers to stop moving around. Okay, and it looks like the audience really does have a pretty great awareness of the National Health Service Corps Scholarship Program. It is true that you can receive funding now in return for a 2 to 4 year service commitment later. 93% of our audience selected true on this one. I'll go ahead and move to the next slide. Thank you. Okay. So through our scholarship program, this slide really touches on eligibility. Who is eligible for a scholarship? Again, really want to emphasize that we're looking for students that are pursuing careers in primary healthcare. Eligible degree programs include physicians, both allopathic and osteopathic physicians. Dentistry degree programs are eligible as well. And then we have several other eligible degree programs, which include nurse midwives, nurse practitioners, physician assistants. And you'll also see that we've got some of the specialties that are noted there that help us kind of focus on primary care. We'll go ahead and move to the next slide, please. Thank you. So this slide sort of answers our poll question. Students who commit to serve at an NHSC approved site in a high need area upon completion of their training will receive a 2 to 4 year service commitment, depending on the number of years of support provided. Our program is statutorily limited to providing a maximum of 4 years of support. And then we do also require a minimum 2 year service commitment. Outside of those parameters, you will see a 1-to-1 ratio, right? So if you request 3 years of scholarship support, you'll receive a 3 year service commitment. 4 years would result in a 4 year service commitment as well. Again, the service commitment is a minimum of 2 years. So anybody applying would certainly want to request at least 2 years of funding. Go ahead and move to the next slide, please. Thank you. So diving a little bit deeper into eligibility, and we'll see this really with all of our programs. First, you have to be a U.S. citizen or national. You must be a full-time student at an accredited school, pursuing a degree. And again, both physician categories are eligible, both osteopathic and allopathic physicians. Our dentists are eligible, nurse practitioners, certified nurse midwives, as well as physician assistants. Our physicians, as you probably already know, are required to complete postgraduate training in an accredited primary care training program, while our dentists, nurses, and physician assistants are certainly encouraged, but not required, to complete an accredited postgraduate training program. The final column here on this slide really touches on the benefits again of the scholarship. The scholarship will pay full tuition, that monthly stipend, which is right now, it's I believe it's $1,450 is the monthly stipend amount. We do inflate that each year, so that amount changes each year, goes up just a little bit. And then finally, the other reasonable cost payments for things like books, health insurance, and equipment. We'll go ahead and move to the next slide, please. Okay, so what does the service commitment look like? The NHSC service begins upon graduation and completion of any required primary care residency. The National Health Service Corps does have resources to work with scholars to find a practice site that's right for them and meets the required minimum HRSA score. And again, we're always guilty of using too many acronyms. HRSA stands for a health professional shortage area. Again, our goal here is to connect primary care clinicians to areas in need across the country. A health professional shortage area score is determined really on a complicated formula that looks at population versus the number of clinicians in a certain area. And each area throughout the country will have its own HRSA score. You might be surprised, the HRSA scores really range throughout urban communities, rural communities, even tribal communities. So there are many HRSAs that are eligible for completing your service commitment throughout our great nation. While in service, the scholars will receive a competitive salary paid by their site. So not only do you get the benefits of the scholarship while you're in school, there is no reduction in salary, right? When you go serve at an NHSC approved site, you'll negotiate that salary with the site at a market rate. We'll go ahead and move to the next slide, please. Okay, we've got one more poll here. Next, we're going to begin talking about the Students to Service Loan Repayment Program. That's another student-based program. The poll here is going to ask, what amount can you receive through the Students to Service Loan Repayment Program? A, $300,000, B, $120,000, C, $60,000, or the final answer, D, where there's no limit. And again, we'll hold for just a minute as the numbers jump around here in terms of selections. Okay, so let's see what our audience thinks here. Looks like 35% of the audience has selected the $300,000 option. 18% of the audience went with $120,000. 12% of the audience noted $60,000, and then 35% of the audience mentions no limit. We'll go ahead and take the poll down and move to our next slide. And we'll kind of get the answer to our question as we move forward. So through the Students to Service Loan Repayment Program, and we do have a banner there that program will be opening soon. I'm not under the impression that too many folks in our audience are necessarily in their final year of school, but this is something to keep in mind as you go through your academic program. That Students to Service Loan Repayment Program offers up to $120,000 in tax-free loan repayment for 3 years of full-time service or 6 years of half-time service. Loan repayment begins during residency, and with continued service, eligible providers may be able to pay off all their student loans. Essentially, the way that works, once you've completed the service commitment through the Students to Service Loan Repayment Program, we offer you the opportunity to move into our traditional loan repayment program. And anyone who's been in the Students to Service Loan Repayment Program will receive a funding priority as they consider continuing into the traditional loan repayment program. We'll go ahead and move to the next slide, please. Thank you. So this slide is going to touch on eligibility requirements for the Students to Service Loan Repayment Program. Again, with all of our programs, you must be a U.S. citizen or national. You must be a full-time student in the final year at an accredited school pursuing a degree in medicine. Both allopathic and osteopathic physicians are eligible, of course. You must complete an accredited primary medical care residency in an NHSC approved specialty. We have those listed there. And then finally, of course, it would make sense that you have unpaid government or commercial loans for school tuition, reasonable educational expenses, and reasonable living expenses. And these debts do have to be segregated from all other debts. We'll move to the next slide, which is going to touch a little bit on eligibility for our dentists. Again, very similar here. Must be a U.S. citizen or national. Must be a full-time student in the final year at an accredited school pursuing a degree in dentistry. Both DDS and DMDs are eligible. We do encourage our dental candidates to complete an accredited postgraduate training in an NHSC approved specialty. We found from feedback from some of our dentists historically that really once they went into service, they felt like they should have pursued a residency just to get a little more training under their belt. So again, we strongly encourage, and we also do a lot of messaging around HRSA funded residency programs for dentistry. And then the final requirement again for all applicants to the Students to Service Loan Repayment Program, that loan repayment is based, of course, on any unpaid government or commercial loans for school tuition, reasonable educational expenses, and reasonable living expenses. They do have to be segregated from all other debts. What will happen often as you approach the end of your schooling, loan providers will reach out and encourage you to consolidate debt to get a lower interest rate. And we do have to be sure we keep the educational loans outside of anything like a car loan or anything like that. Move to the next slide, please. So this again, one final eligibility criteria or category, I should say. Those are for our nurse practitioners and our certified nurse midwives. Again, you'll see a lot of similarity here on the screen. Must be a U.S. citizen or national. Must be a full-time student in your final year of school. These nurse practitioners and certified nurse midwives are certainly not required to complete postgraduate training, but we do strongly encourage them to do so. And then finally, they must have unpaid government or commercial loans for educational debt. We'll move to the next slide, please. Thank you. In last year, we finally added physician assistants. They have not historically been eligible for the Students to Service Loan Repayment Program. We were super excited to get them added to the program last year, just expanding the eligibility for that Students to Service Loan Repayment Program. Again, the eligibility criteria very similar, and they are listed here on the slide. I will go ahead and move to the next slide, please. Thank you. We have.
I went to college.
We have a thank you. We have a number of great member stories that are out there on the internet. Really, at any point in time, you can do an internet search for NHSC member stories. We did want to share one with you this evening. This is Brian Freeman, who has been in our Students to Service Loan Repayment Program. Please go ahead and advance the video now. Thank you.
And want to do biomedical engineering. But it wasn't until my third year of medical school that I got out into the communities where I actually saw patients, that I saw that I really had a love for this type of medicine, for primary care. And so for me, it was a decision, what is it that I really wanted to do? My heart was in the primary care. I'm Brian Freeman, NHSC Student to Service Loan Repayment recipient. Right now, I'm a third year family medicine resident here at Fairfax Family Practice. I'll be looking forward to start my service commitment. My immediate goal is to get into an environment with the National Health Service Corps that I can see myself in for longer term. I actually look forward to it because working with underserved populations, you get to see things with these populations that you don't see in affluent populations. And how long were you congested for when you were pregnant? Especially in primary care, you need to be able to communicate with the wide range of people from all different socioeconomic backgrounds and conditions. And have fun with those babies.
All right, thanks.
Underserved communities means to me working with these people to fill a gap, to allow them to have good health care just like anyone else would. In primary care, especially family medicine, we are their one-stop shop for about 90% of their health care needs. We say it all the time here in family medicine, it's that relationship that you have with the patients. And it's cliche, but it's not really cliche. Because if you have a good relationship with the patient, you can stave off a lot of healthcare concerns that the patient has. Up on your toes and down. Good primary care is primary care that you are actively involved and are the patient advocate.
Great, doctor. Thank you very much.
Primary care has that challenge and it had to attract people to come to the field when student loans is such a big issue. And that's why this program is so great, the National Health Service Corps. Money is a consideration for 100% of our medical students in this country. I like primary care, but I'm not going to make enough money to pay off my loans. This new program by the National Health Service Corps is called the Students to Service Program, which was great because it wasn't a scholarship program where you had to be committed to it in med school. It's something that you can apply during your fourth year when you're already applying to residency anyway. And so for those of us who are applying to primary care fields, this program is excellent because it gives you the ability to practice what you love to do, but then not have that financial burden associated with it. I thought it was perfect. When I got the email saying that I had received one of the awards, $113,000. It literally was a huge sigh of relief because now I recognize, man, my financial burden is almost gone. Last month, we welcomed my first child, a daughter, to the world. Her name is Amaya, and she's been a great joy for us. A lot of work, but a lot of joy. I know now that we can start saving for her college education, thinking about getting a house when I get out of residency as opposed to staying in apartment living for several years afterwards. And so it really just frees us up to do the things that we like to do. The benefit of being in the National Health Service Corps is seeing the widest possible range of patient populations, of disease states, of clinical conditions, of socioeconomic backgrounds. That will make you able to be a better communicator, a better leader, a better administrator, because you have a wide range of experience. It's a good way to give back to my community that's helped me growing up. Personally, I can say that a lot of my family, my cousins, my extended family, my grandparents, and my parents when they were growing up too, are underserved. They're from rural or very urban inner city communities where the access to healthcare is not good. I get to serve this population who do a lot for all of us. I only feel it appropriate for us to help them with their health care as well.
Very good. Thank you for that. So Dr. Freeman was really one of the early recipients of the Students to Service Loan Repayment Program. That program began way back in 2012. And again, you can do an easy internet search if you'd like to hear more about some of our member stories, just to get a feel for what their experience has been with our programs. Again, just any internet search for NHSC member stories. And I always get a great smile on my face when I read this. It makes me proud to serve in the role that I do. We'll go ahead and move to the next slide, please. So now we'll get a little bit into our clinician programs. And as I had mentioned, these programs are really our loan repayment programs, and they are really intended for individuals who at this point in time are fully licensed. I will go through these slides a little bit quicker, just given how much time we have. We want to make sure that we have time available for questions and answers. But I do also want to provide some awareness, right? And for you personally, right now might not be the time to commit to serving in an underserved area. Maybe you're not 100% sure that you want to pursue primary care. And if that is the case, you can certainly wait till later and then consider applying to one of our loan repayment programs. We'll go ahead and move to the next slide, please. Thank you. So some of the NHSC loan repayment program benefits. Of course, the NHSC helps remove financial barriers for primary care clinicians, enabling them to provide care in high need areas. A portion of the service obligation can be fulfilled by teaching. We have some great flexible service options, meaning that you can choose to serve full-time or part-time. And the great benefit is that we're increasing access to primary care services to communities in need. Okay, move to the next slide, please. Thank you. So this evening we'll focus really on three of our NHSC loan repayment programs. First is our traditional loan repayment program. Through that program, you can receive up to $50,000 in award funding. We recruit, retain medical, dental, and mental behavioral health clinicians in underserved areas. We also have an NHSC substance use disorder workforce loan repayment program. One of the great things about the National Health Service Corps is we are able to respond to emerging healthcare needs throughout our great nation. And we're quite aware that substance use disorder treatment in recent years, the need for that has gone up significantly. Through that program, you can receive up to $75,000 in loan repayment loan repayment funding. And then finally, our NHSC rural loan repayment program, very similar to SUD. However, you're committing to serving in a rural area. Through that program, you can receive up to $100,000 in loan repayment program funding. Next slide, please. So focusing in just a little bit on our traditional loan repayment program, again, you can receive up to $50,000. The service commitment for that $50,000 is 2 years. Through that program, you can be awarded what's referred to as a continuation contract. And over time, providers may be able to pay off all of their student loans. We'll go to the next slide, please. Thank you. So just a little bit more information about our loan repayment program. Providers receive the loan repayment in addition to a competitive salary from their employers. Providers will find a job at an NHSC approved site, then apply to the NHSC loan repayment program, right? So kind of highlighting the benefit of the loan repayment program versus the scholarship program. While the funding is probably more robust through the scholarship program, the loan repayment program really removes some of the uncertainty about where you might work once it's time to begin the service commitment. And that's really done by having our applicants find that position at an NHSC approved site first, and then apply to the program. Next slide, please. The traditional loan repayment program, this is our eligibility slide. Again, must be a U.S. citizen or national. This will be across the board with all of our programs. You must be currently working or applying to work in an NHSC approved site. Of course, you must have unpaid government or commercial loans for educational debt. And then you have to be licensed to practice in a state where an employer site is located. We've got some additional information at the bottom of the slide related to eligibility and the vast different types of clinicians that are eligible for this program. I will, of course, highlight that physicians, both allopathic and osteopathic physicians, are eligible for this program. We'll move to the next slide, please. Thank you. So just some highlights on our substance use disorder workforce loan repayment program. Again, a little bit more funding involved here with this program. It awards up to $75,000. The service commitment is actually 3 years versus 2 years for the traditional loan repayment program. You do have to be trained and licensed to provide SUD treatment and an NHSC approved SUD treatment facility. Again, the goal of this program is really a great one in that we're trying to get more clinicians out there to deal with the great substance use disorder issues that we have across our great nation. We'll move to the next slide, please. So touching on eligibility for the substance use workforce program, disorder workforce program, again, very common here, must be US citizen or national. We've listed out the eligible providers. MDs and DOs are of course included. You must be licensed, trained and licensed to provide SUD treatment. And then finally, as with all the loan repayment programs, you must have unpaid government or commercial loans for educational debt. Go ahead and move to the next slide, please. Thank you. Now, finally, our rural community loan repayment program. Through this program, we actually award up to $100,000. Again, the service commitment is a 3-year service commitment, similar to the SUD program. Our traditional loan repayment program, that one's only a 2-year service commitment. But here with the rural community loan repayment program, awards are up to $100,000 for a 3-year service commitment. Of course, you must be trained and licensed to provide SUD treatment in an NHSC approved rural SUD treatment facility. The primary difference between this program and the other SUD program is really that we're focused on rural communities and just trying to get a little bit more support out there to those rural communities. We'll go ahead and move to the next slide, please. Thank you. So here's our eligibility slide as it relates to the Rural Community Loan Repayment Program. Again, as always, must be a U.S. citizen or national. Our eligible providers are listed there. The allopathic and osteopathic physicians are included. Nurse practitioners, certified nurse midwives, physician assistants. It's really quite the robust list. You'll see that there are additional types of clinicians that are eligible for this program as well. And then you must be trained and licensed to provide SUD treatment. Again, that is kind of the focus of this program, but more so on rural communities. And then finally, you must have unpaid government or commercial loans for school tuition. We'll move to the next slide, please. So medications for opioid use disorder training, we have partnered with the Substance Abuse and Mental Health Services Administration, so the providers of the PCSS program to try and connect clinicians to free medications for opioid use disorder training. We really find this to be a hugely important effort throughout our nation. Again, the opioid use disorder issues in our community is becoming more and more prevalent each year. And it's our effort to sort of address these issues and try and get additional support out there for our underserved communities as it relates to managing opioid use disorder. We'll go ahead and move to the next slide, please. Thank you. So finally, we'll dig in a little bit to our supporting resources. As mentioned, the National Health Service Corps has been around for 50 years. We are a robust program, and with a robust program comes robust support and resources. We'll go ahead and move to the next slide, please. First is our Health Workforce Connector for job seekers. This is a great opportunity for us to help connect program participants to approved NHSC sites nationwide. I would encourage you, if you want to get a sense of, where are the approved sites throughout our nation, you might be surprised. There may be one in your backyard. There are really thousands of approved sites across the nation. By accessing the Health Workforce Connector, you can get a sense of what approved sites are out there. Now, keep in mind, if you're just now going into medical school, it could be 6-7 years down the road before you're ready to connect to a service site. So the actual opportunities that are in there today, they may not be there 7 years down the road. But again, I think it will give you a good sense of the vast variety of approved NHSC sites that are out there. And again, these can be in rural communities, urban communities, suburban communities, tribal communities. Really, the health professional shortage areas across our great nation are certainly vast. We'll move to the next slide, please. Okay, I think we've got one more poll here. So clinicians can serve in NHSC sites like A, community mental health facilities, B, private practices, C, school-based clinics, or D, all of the above. Very good. So we'll give it just another minute here or two for answers to continue to come in. Okay, I think the numbers are stopping to are no longer bouncing around. So we have 81% of the audience selecting all of the above, along with 19% of the audience selecting community mental health facilities. We'll go ahead and end the poll and move to the next slide, please. So NHSC approved sites, NHSC clinicians served at approved sites throughout the nation. NHSC approved sites are outpatient facilities providing primary care, medical, dental, and or mental and behavioral health services. Facilities may be located in rural, urban, or tribal communities. So the answer to the last question, of course, was all of the above. We've also got a final bullet point there. If you have we have an option where sites can apply to become approved NHSC sites. Go ahead and move to the next slide, please. So again, just an additional list of eligible sites for the National Health Service Program. Federally qualified health centers, that includes community health centers, migrant health, homeless programs, public housing programs. Federally qualified health center lookalikes are also eligible. Indian Health Service facilities, certified rural health clinics, correctional or detention facilities, critical access hospitals, community mental health centers, state or local health departments, community outpatient facilities, private practices, school-based clinics, mobile clinics, free clinics, and substance use disorder treatment facilities. Really, the purpose of this slide is to emphasize the vast range of NHSC sites that are eligible to perform your service commitment. And we'll go ahead and move to the next slide, please. Thank you. So finally, support and resources for approved SUD treatment facilities, just digging a little bit more into the weeds here. To be an NHSC approved SUD treatment facility, sites must have demonstrated that they meet the requirements set forth in the NHSC site agreement and NHSC site reference guide, including submissions of SUD documentation. Really, to kind of cut to the point on this side, we are trying to make sure that we make a good impact on substance use disorder across the nation. So the criteria for substance use disorder approved facilities is just a little bit more stringent than some of our other programs. Go ahead and move to the next slide, please. So finally, this is a contact us slide to learn more on the web. You can get all the details for applying on the NHSC website, which is listed here on this slide. We have additional NHSC resources. We have a customer care center, which you can see the contact number for here in the slide. Hopefully we hope to get these slides sent out to everybody in the audience, just so that you have this as a great resource. And then finally, you'll see that we have several social media sites as well on Facebook, Twitter, and LinkedIn. We'll move to the next slide, please. All right, so you can also learn more about HRSA as an agency. by connecting to www.hrsa.gov. Really, the support that the Health Resources and Services Administration provides across our great nation is vast. So we'd encourage you to visit our site and learn more about HRSA programs as a whole. You can also sign up for the HRSA e-newsletter. And then you can follow us on any of the social media platforms listed there on the screen. We'll move to the next slide. So that really brings us to the conclusion of the materials that we wanted to present and create an awareness for you today. We really hope that you have some additional awareness on NHSC programs at this point, the eligibility requirements for those programs, and of course, the financial benefits and service commitment tied to those programs. We'll now open up the floor for questions. I know that we have some questions that have been entered to the chat. We'd also encourage you to raise your hand if you would like to chime in with a question. I think hopefully our moderator will be able to start either reading some questions off for us or selecting some questions to answer verbally.
Thank you so much, Chris, for the presentation. But I think Michaela had a question. Michaela has her hand raised at the moment.
Yes, hi, my name is Michaela Richardson. I had a question about like the student programs. So if a student goes through, obviously they get accepted into the program and things like that, but then they have to do their commitment to service. If they wanted to do like, say like a fellowship in like psychiatry, would that still be accepted? And then how would that work with service if they wanted to complete like a fellowship?
Yeah, and that's a great question, Michaela, thanks for chiming in. We do approve fellowships. The one you mentioned, the psychiatry, is definitely an approvable fellowship. That would just result in an extended deferment of your service commitment. By default, MDs and DOs will have a 3-year residency. We put you in a deferment status during that time while you complete your training and preparation to go into your career. And then the fellowship would be an additional year of that deferment. Our program will allow up to a maximum of 5 years of deferment before beginning your service commitment. So I think a great question, and thank you for chiming in.
Thank you.
Question is from Rashina.
Thank you. Hi, Christopher. Thank you for being here. This presentation was very insightful. I asked a question in the chat earlier. It was just, are you able to qualify for the loan repayment service and the scholarship service? Like say you have loans from undergrad or a master's program, but then like you're applying to medical school and you get the scholarship, would you also be able to get the loan repayment program too?
Absolutely, and thank you for that question. The way that would work, individuals going into our loan repayment program who have participated in our scholarship program, you'll actually receive a funding priority. But to be clear on how it works, once you've gone through the scholarship program, and this is a very, I don't know if it's super common scenario, but it's a very realistic scenario, right? That you had that educational debt from undergraduate education. So the way that would work, if you received the scholarship, you would need to complete your scholarship service commitment first. You could then apply for the loan repayment program to receive benefits through that program as well. And again, anybody who's been in an NHSC program will receive priority as it relates to perhaps moving into the loan repayment program or something like that.
So if that was the scenario, the total repayment time would be 8 years.
So if, and let's talk it out a little bit, through the scholarship program, you'll end up with a 2 to 4 year commitment, depending on how many years of funding you requested. So let's just take an example of maybe you did 4 years of scholarship funding, right? So that service commitment would continue 4 years. Then when you applied for the loan repayment program, if it's the traditional loan repayment program, you can receive up to a $50,000 reward, and you'd receive a 2-year service commitment through that program. We find that many of our program participants tend to remain in the underserved communities that they started in. And it is rather common for individuals to still have educational debt from their undergraduate education, remain at the site where they were at because they're comfortable and used to living there and working there. They've connected with the community, and then they can simply jump into the loan repayment program from there.
That makes sense. Thank you. And just one last question. When should we be applying? Because I'm applying to medical school this cycle. So when is a good time to apply for the scholarship program? And do you have like any tips that can help us with the application?
Absolutely, absolutely. Great question. So our scholarship program application cycle tends to open March of every year. So if you have applied to and been accepted to a medical program in the following year, right, you would apply in the spring, and you're not limited, right? If you're in year one of your academic program, you can still apply, right? That application is open. Again, it tends to be from March to May of each year. And I'm sorry, I forgot the second part of your question. Definitely would apply in the spring.
Mm-hmm.
Oh,
The second part was tips like to help to construct a great application.
Yeah, and that is a great question. I'd love to share with you. So we have a couple of funding priorities for our scholarship program. The first one is that you were a current participant, right? That one, you're not a current participant, so you wouldn't fall into that highest tier unless you were doing a continuation. The next one is that you demonstrate characteristics likely to remain in a health professional shortage area. This is demonstrated through the application material and your history, like your resume, right? So you'll respond to essays during the application cycle, and you'd really want to emphasize your connection to underserved communities. Additionally, you'll submit a resume as part of your application materials. And if that resume demonstrates that you've already, maybe done some work in underserved communities or had some sort of focus on underserved communities, that would bode well for you in the application process.
Thank you for that.
I see, and I'm just going to go with the hands I can see raised on my screen. So moderators, please help me out a little bit if needed. I see Michaela has another question, or maybe you still have your hand up. I wasn't sure, but please feel free to chime in if you had another question.
We have another question. I was wondering, for the students that go into the one of the student programs, how does it work for being placed at a site? Do they get to choose or rate? How does that placement?
So we do not dictate what site you go to. I had mentioned as we got to the support and resources section of the presentation, we have the health workforce connector that's out there. If you wanted to get a sense of what service sites might be available near you or in your preferred areas, you could certainly go into the health workforce connector and see what kind of approved sites exist in your preferred areas. Our goal here at the program is to have all of the program participants select their own sites. Now, we don't want to be, we don't always know that there's going to be something right at the corner in the community that you live in, right? So you don't want to think to yourself, I might not have to move at all. You might not, but there's no guarantee on that. I would just emphasize that there are many NHSC approved sites across the nation, and it's up to the participant to select their preferred service site. And again, you can get a sense of where those sites might be located by having a look at our health workforce connector.
Thank you so much.
Absolutely. Thank you for the question.
Are there any other questions? Feel free to, you can either, raise your hand or you can include them in the chat. And then actually, I have a question. So for the substance use disorder loan repayment program, you mentioned that you needed to be trained in substance use disorder. Is that like an additional certificate that you get during residency, or is that an actual specialty? Could you clarify what that That's the different, what that
It-
is.
Yeah, it is more of a certificate that you would get. I did breeze through that section kind of quick. I knew we were getting a little short on time. Within the presentation, you'll see a mention of a Data 2000 waiver. I hope I'm saying that correctly. But essentially it's a certification that you would get that essentially validates that you know what kind of medicated treatments might help, things along those lines.
Thank you. And just the last call, if there are any other questions, feel free to just ask in the chat, or feel free to unmute and raise your hand. But if not, this was a wonderful presentation. I really appreciate you all coming to really share the information about the scholarship and loan repayment programs to really start to tackle the amount of debt that a lot of medical students have coming from what is it, medical school, and then pursuing residency and still having that debt. I think that these scholarship opportunities are an amazing opportunity to really start to minimize the amount of lifetime debt that we have as students. But I really appreciate you all for coming out, and thank you so much for spending the evening with us. But if there are any, there's nothing else, really would like to mention this, to have a good night. I hope you all have a great rest of your week.
Thank you so much, and thank you so much for the opportunity to come out and speak with the SNMA community. It's hugely important for us to get out there and connect with folks and bring awareness of our programs. Again, I can't emphasize how our programs can be just a winning situation for everybody involved, both the program participants and the underserved communities across our great nation. Thank you so much, everybody, and be safe and have a wonderful evening.
Thank you,
Good night,
everyone.
everyone.
Thank you so much. Have a great night.
Thank you.